Hi, everyone, and welcome back. My name is Dr. Samantha, and I'm the maternity mentor. And we're here again on another Monday at 9 p.m. Eastern Standard Time for one of our live Q&A sessions. This is a chance for you guys to interact with me and for me to interact with you. I can answer your questions live. You can just put those into the chat, as well as answer any questions that you might have put on some of our videos this week. Please remember, share our channel with your friends and family. You can follow us on Facebook, Instagram, and Twitter for additional content. We will link those into the description. And please subscribe to the channel and hit the notification button. Subscribing to the channel really helps me out, and I really appreciate all of your support. And when you hit the notifications bell, you're going to get notified of some of our latest content. And for those of you who stick it out until the very end, I will give you a sneak peek on next week's video. While everybody's getting going, I'm going to go ahead and I'm going to get started with some of the questions that you guys have put onto the videos this week. So again, if you have any questions, please feel free to put them into the chat. So we had a lot of good questions this week. Let's start with breastfeeding while pregnant. So I'm currently 18 weeks along. I have an 8-month-old baby, and I don't know what to do. My baby just keeps crying. She has refused eating and taking formula, only breastfeeding, and I'm getting down as the day passes. What should I do? So when you are pregnant, believe it or not, you can breastfeed, okay? A lot of people don't realize this, but breastfeeding is okay and is very commonly done when women are pregnant. The reason why women are told not to breastfeed is because there are two things that could happen. One, you could stimulate contractions. So nipple stimulation releases the hormone oxytocin. Oxytocin is the milk ejection reflex hormone. So this is the hormone that says release milk, okay? But oxytocin is also the hormone that says uterus contract, which of course is what happens when you're in labor. So if women have a very, very strong oxytocin response when they're breastfeeding, sometimes if you're pregnant, that could cause some uterine contractions, which might stimulate preterm labor. So if you have any risk factors for preterm labor, you're going to want to go ahead and you're going to want to make sure that you're checking in with your healthcare provider before breastfeeding. The other reason why some women can't breastfeed while they're pregnant is probably the reason why this mom is struggling. So our bodies, when we are pregnant and not breastfeeding, we will go ahead and our bodies will start making colostrum around like the 6th month of pregnancy, approximately. Okay, the colostrum is that first milk. It's the little teeny tiny milk that's highly concentrated, lots of the antibodies, sugar, fats, protein, everything your newborn needs. And so this milk is the first milk, but it's very small in quantity because your newborn has a very, very teeny tiny stomach when the baby's first born, right? Okay, so the baby is born and you only have this colostrum. It's totally fine. But if you're breastfeeding a full-term baby, an 8-month-old baby, that little bit of colostrum isn't enough to feed that 8-month-old. The problem is, even if you have a full milk supply, sometimes that full milk supply will actually dry up and go back to the colostrum state while you are pregnant. So most likely for this mom who's struggling with an 8-month-old who's not able to eat and is acting very hungry, crying all the time. Now, the problem is an 8-month-old who knows that mom's right there and wants to breastfeed is not going to take a bottle. If you don't introduce a bottle soon enough, babies just won't take them anymore. So what are some of the options? Well, for starters, you can offer milk in a sippy cup. Okay, a lot of people forget that this is an option for them. Now, yes, your 8-month-old may not be able to use a sippy cup as well as, say, a toddler would. So you may have to help them. But with a little bit of time, your 8-month-old, 9-month-old can actually use a sippy cup very successfully. And they may actually use this better than they would a bottle and a bottle nipple. Now, second to that, when you're trying to teach the 8-month-old to drink formula and stuff, you are going to need to have somebody else do that. A baby who's been used to breastfeeding is not usually going to take formula from mom because she can smell the milk on you, your breast milk. So you're going to need to have some other family member offering the baby formula, and you need to leave the room because otherwise baby's not going to take it. Finally, the baby is old enough to eat complementary foods. So you can start to give the baby foods or foods that are soft off of your plate. If you're concerned about how much milk or protein the baby's getting, you could try to trick the baby by adding that into your food. So if you're using like a pureed baby food, for example, green beans that are pureed, right? You can add formula to those green beans, and then the baby's getting little bits of formula here and there to try to sneak it in. So those are some tips. You definitely want to talk to your pediatrician. And if you are breastfeeding while pregnant and your healthcare provider says that's okay, you need to monitor the baby's weight and make sure that the baby is gaining properly. If the baby is not gaining weight, losing weight, or having not enough pees and poops, then you can no longer breastfeed while pregnant. So that was a really good question. So I see a question from Anonymous. And this is a great question, actually, probably one that I should do a video on. So it says, any advice on dealing with pup rash? Okay. So pup rash stands for pruritic urticarial papules and plaques of pregnancy. Basically, what this is a rash that's itchy and hive-like and forms on different parts of your body, including the stretch marks of your belly. Okay. It is extremely frustrating for most women. You usually see it on like the lower part of the belly. Unfortunately, this is an extremely annoying rash, and there's not much that we can do about it. So it is more common if you're having like twins or triplets. Sometimes if it is your first pregnancy, you're more likely to have it. Now, this rash can be like really itchy and it can scatter, okay? And it's kind of pink and purpley. And we're not really sure what's causing it, which is part of the issue, because then that leads us to have trouble to figure out how to treat it. We do want to make sure that the rash is not associated with like high liver enzymes, which can also be associated with preeclampsia. So a lot of times if a mom is saying she's really itchy and she has anything going on, we're going to go ahead and we're going to do some blood work to make sure that that's not the case. We also may go ahead and like test you for allergies. Make sure you haven't developed some kind of allergy. Once we know that it's pups, unfortunately, now we're kind of dealing with homeopathic treatments mostly. So oatmeal baths are really good. You can also use calamine lotion, which is a lotion you can find over the counter. You need to avoid all sorts of irritants. So belly creams, perfumes, powders. If you switched your laundry detergent, you want to go back to like a clean and clear laundry detergent. Cotton underwear. All those fancy underwears oftentimes are really bad for our skin. And then you can ask the doctor about possibly like anti-itch creams like or antihistamine creams like Benadryl or hydrocortisone cream. Sometimes they'll even give you a stronger prescription strength hydrocortisone cream to put on the top. And then they may also give you antihistamine pills. So this is like Benadryl or Sudafed to help with the itchiness. Now, one of the things you guys need to know is that if you do have or if you are recommended to use like an antihistamine type of pill like Benadryl or Sudafed, you need to be careful if you're close to delivery. Both of these medications, they can help with itchiness, but they're meant to dry you out, which means they can actually dry up your colostrum and they can prevent you from getting a full milk supply if you're very close to delivery. So make sure that you're mindful of that when you go ahead and you get treated, okay? But that was a really good question. It is unfortunately very common, and it usually goes away almost right away from the time you deliver, but up until that point, it's just extremely annoying, and sometimes it keeps people awake at night, so it really kind of stinks. I hope that helped, Anonymous. I got another question. Dear, this is bleeding, but it also has to do with IVF. It was a good question. Dear doctor, I have a positive result after IVF. The first result was 1,500. After 48 hours, the result became 4,200. But the day after that, I got some blood and stopped. I am afraid. Can you explain to me the reason for this? I'm currently in my 4th week and 5 days. Okay. So let's talk about a couple things in this. So this person mentions some, yes, it's terrible, Anonymous. You are definitely not alone. And it's, people underestimate how that itchiness is just really, really, really awful. So in this IVF question with bleeding, she mentions some numbers. So she mentions the 1,500 and then the 4,200. So she's referring to HCG levels. So HCG is human chorionic gonadotropin. This is the hormone that we measure in your blood or when you're urinating on one of those pregnancy tests on those pregnancy tests to determine if you're pregnant. Okay, if you have HCG in your urine, that usually means you're pregnant. And when we're checking your blood, we're checking to see that the number is going up. If your number is going up, even if you're bleeding, that usually means the pregnancy is doing okay. That's what we expect. If we suspect a miscarriage, sometimes we'll run a number and then a couple days later we come and take your blood again and we run it again. And if the number's dropping, then unfortunately, most likely a miscarriage is happening. So these numbers, what she's referring to, are showing that the pregnancy is potentially going well. So then she's saying, well, but then I had some bleeding. So what's going on? So she mentions that she's in her 4th week and 5 days. Very early on, and we have a video on this, there are a couple reasons why you might see bleeding. Now, one of the most common reasons is sex, because the hormones related to pregnancy thin out the vaginal tissue, and that can cause you to bleed if you're having sex. But when you're going through IVF, they usually will not let you have sex. So when you're talking that's out of the picture, what's another common cause? Another common cause is implantation bleeding. So when you actually get pregnant, generally speaking, you have an egg that's released and the sperm meets it into the fallopian tube. And then that fallopian tube, the egg passes down into the uterus. Your uterus is like this, and then it ends up going on the side, right? So when you have IVF, right, you have that fertilization take place out of the body, and then they insert that into the uterus. But that fertilized egg still has to implant into the uterine wall. If it doesn't implant into the uterine wall, the pregnancy is not going to maintain itself. So it is very possible, depending on the timing of this, that this was simply uterine bleeding. The other thing is there's other causes, including subchorionic hemorrhage, which is a pool of blood. And you can also have some other things like the most important thing is you need to contact your healthcare provider whenever any bleeding, because what they're going to want to do is they're going to want to do an ultrasound to see if they can determine the cause. For certain causes, they may have you do certain things. So it's very important for you to go ahead and let them know. But there's plenty of reasons why women will bleed. Also, it could be that you are getting one more cycle of your period. A lot of women will have one last period, even though they're pregnant, and they may not even know that they're pregnant. And that cycle may not be like a complete cycle. So the period will seem weird to them. And that's often an indication that they're pregnant. So that's some of the reasons why. Okay. Hi, Stephanie. I'm so sick to the point where I'm choking on vomit like my food won't digest. Help a sister out. I'm 9.5 weeks pregnant. I have 2 other kids, and this is the worst. Stephanie, I completely understand what you are talking about. So Stephanie is most likely referring to hyperemesis gravidarum. So hyperemesis gravidarum is morning sickness, but it's excessive morning sickness. It's not your normal, I throw up every once in a while. Maybe I'm nauseous here or there. Hyperemesis gravidarum is very, very, very serious, debilitating morning sickness and vomiting. If left untreated, you can end up in the hospital due to dehydration and weight loss and other things. Hyperemesis gravidarum has been shown to even cause PTSD in some women because it's just so debilitating. So I can tell you, Stephanie, that I personally suffered from hyperemesis gravidarum. My first pregnancy, I was hospitalized for a week. My second pregnancy, I had a toddler at home. So, you kind of try to suffer through it. I lost 32 pounds in my second pregnancy. I didn't gain any weight during that pregnancy. I can tell you for years afterwards, I couldn't stomach the thought of eating spaghetti because of all the times I threw up. So it's very, very, very traumatic for a lot of people. So what can you do? Fortunately, there is some newer treatments that are out there that can help. For starters, when you go homeopathic, I know a lot of people try some of this stuff and it doesn't work, but starting with ginger is amazing for a lot of people. A lot of women discount that because they'll try just like a standard ginger ale and that doesn't work and they just assume it's not going to work. But here's the thing. It's actually been shown that natural ginger, like real ginger that you shred, is actually much more effective than say like ginger ale, because ginger ale oftentimes doesn't have any ginger in it. The ginger pops are often really good. And sometimes if you can't stomach the actual taste of it, you can hide it, a little tiny bit of it, in something else. Okay. So that's number one. Number two, you've got to reduce the acid content. The more acidic your stomach is, the worse it can be. So try to eat stuff that's basic, or stuff that's kind of like very, like not spicy. So no tomato based stuff, no juices that are highly acidic, like orange juice, stuff like that. Next, when we're sick with like a stomach bug, what do they tell us to do? The brat diet: bananas, rice, applesauce, and toast. Okay. Very benign, very calming stuff. So you want to eat bland foods. Bland foods are more likely to stay down than some of the more exotic foods. Ask your doctor about some medication. So there's this amazing medication called Diclegis. Diclegis is excellent for the treatment of hyperemesis gravidarum. However, Diclegis is not usually covered by insurance and it's extremely expensive. Well, it turns out Diclegis is a combination of vitamin B6 and Unisom. So ask your healthcare provider if you are able to use those two over-the-counter medications in the right dosing, and it can help with your hyperemesis. There's also Zofran and Zofran pumps. Zofran pumps are a little pump that a needle will be put into your belly, and it's really tiny and it gets taped there, and it will deliver Zofran, which is a anti-nausea medication, at a regular basis. Make sure you're drinking like Gatorade and stuff. Keep yourself hydrated. That's so important. If you're not hydrated, you're going to end up in the hospital. And then finally, like, take every day 10 minutes at a time. There were days where I would take like a sip or two of something to drink and a couple bites, and I would lay down and I'd close my eyes and I'd just be like, 20 minutes. I just need 20 minutes. Because a lot of stuff, the second it hits your tongue, you're starting to digest it and you're starting to absorb some of the nutrients from it. And then if you can just give your body 15 or 20 minutes, even if you throw up some of that food, you've actually absorbed some of that food. Some of it has broken down enough that it's going into your intestine to go ahead and get digested. So every time you can take a couple bites and keep it down for 15 minutes, believe it or not, you're actually digesting some food. The other thing most people should know, not that this feels good because it doesn't, but your body is designed to protect that baby, which means your body's going to strip everything it can out of every part of you, your bones, your muscles, your fat, and bring it to that baby. So the baby usually ends up being pretty healthy, even if you feel awful. So I hope that helps, Stephanie. Definitely ask your healthcare provider about Unisom and B6. Oh, yes, the metallic flavor. Yes, it's the worst. There is actually something that's probably from the bile that you're like, so bile is that greenish, yellowish substance that comes out of our gallbladder. Sorry, I had to think about it for a second. It helps to break down food, especially fats. When we're eating fatty food, it helps to break that down for digestion. So that's that stuff that's inside of our stomach. It has a metallic taste. So unfortunately, when you are throwing up, you will have that kind of you'll have that kind of taste. But there's also something that's caused by pregnancy and the hormones, and it's called dysgeusia, which is a metallic taste in your mouth. So sometimes, even if you're not eating, you can actually like find that taste. And that one's spelled, and we're going to put it into the chat. It's spelled so you can look it up. It's weird. Dysgeusia, because I'm sure I'm saying it wrong. So that's another reason why you might have that metallic taste. Oh, I see, Stephanie. I didn't even see that comment until after I was done talking. So I hope that helped. You probably may have that dysgeusia. Hi, Gabriella. Okay. Oh my gosh. Okay, so she says, I'm in my 3rd trimester and I didn't know it was not okay to sleep on my back. OBGYN didn't say anything, nor did I ask. I tried sleeping on my side and my arms fall asleep and I tend to get leg cramps. So I sleep with my legs extended and stretched out. How can I make myself more comfortable as a side sleeper? This is a great question. And actually, I have a series coming up in the next couple weeks on beauty procedures that are, whether they're safe or not during pregnancy and postpartum. And one of them, I talk about being on your back while this procedure is taking place, because it's that, it's that important. So you have a big giant vein and that goes down, an artery that goes from your center, like from the center of your body down into your legs. So it goes down and then it splits. When you are pregnant, if you lay backwards, your heavy belly presses on that and it compresses it, which is why it's not good for you. You'll get the pins and needles. But also, when that is compressed, your baby actually gets less blood flow. And that's why you're not supposed to lay on your back. So one of the things that I have, I think it's in my 1st trimester must-haves video, is a recommendation that you get a body pillow. Now, many people get those crazy pregnancy pillows, and I know some people swear by them. They're really great. That's that big C-shaped one. I personally don't think you need all of that. The biggest way to get yourself comfortable to sleep on your side is to make sure you have a pillow between your knees. When your knees are close together like this, it actually pulls your lower back out of alignment and it pulls on your hips, which is what causes a lot of the discomfort. So what you actually need to do is you actually need to take the knees and get them spread. And then if you feel it, if you sit in your bed on your side and do that, you're going to notice that your spine straightens out, which makes it a lot more comfortable. Now, some women also, you can't be a belly sleeper, but you can kind of then shift your hips so you're like 2/3 towards the stomach. Okay, so you're taking a little bit more of that pressure off of your back. And you use this all with a body pillow. So a body pillow that you're kind of hugging and it's going up and under and in between your legs. That is the best way that I can tell you to try to get that sleep in a good position. Okay. Now, unfortunately, in 3rd trimester, part of the reason why women start to complain about their sleep is because you're going to have to turn. So you're not crazy that your arms falling asleep, getting a little bit of numbness. Unfortunately, that has to do with being pregnant and just your blood flow and stuff. You're going to have to flip kind of like you'd flip a pancake. Okay. So you're going to go from side to side. You're going to practice as much as you can. I often tell my 1st trimester moms to go ahead and get started practicing how to be a side sleeper while you have the chance. Now, leg cramps. That is one thing that I'm going to address. That could be something completely different, and that might be affecting your sleep. So that could be low potassium or low magnesium. So low potassium will cause Charlie horse type cramps. Those are those big, tight, all of a sudden you go from 0 to 10 on the pain scale cramps. They usually happen in your calves. Those are extremely painful. What you can do for those Charlie horse cramps is potassium. Now, you're not going to find potassium pills over the counter because those can be actually very dangerous for you. Too much potassium taken the wrong way all at once, like in a pill form, can cause a heart arrhythmia. So when women are short of potassium, what we recommend is that you eat a high potassium food or you drink something that has potassium. So nowadays I would tell you keep some Gatorade by your bedside, like a sugar-free Gatorade. And what you can do is if you get some leg cramps in the middle of the night, drink like half of a sugar-free Gatorade because there's potassium in there. When I was pregnant, like 20 years ago, yes, I'm old, I had to keep a banana at the bedside because I got cramps a lot. So a lot of times in the middle of the night after my husband would like stretch out my muscle, I would eat a banana because that's how I got potassium. The other thing you can do is magnesium. So I do tell moms to kind of run this by their OBGYN just to make sure. But for any of you guys who don't know, magnesium is a smooth muscle relaxant. We actually use it to prevent preterm labor. Magnesium is also given to you if you have preeclampsia, and we give you magnesium to help protect your baby's brain if you were to deliver prematurely. So magnesium is fantastic. And it's really good for helping with muscle cramps. So it's actually like an excellent choice. I love it, Gabriella. I'm glad to hear that. That's one of my favorite supplements. Calm supplements, for those of you guys who don't know, it comes in a tea and it comes in a gummy. It's really good. And for anybody who didn't know, magnesium can also be used for like sleep issues and it can be used for anxiety. So it's one of my favorite things. So that's my best suggestion for you, Gabby, is to just kind of make sure you're getting it between your knees to make sure that you are doing okay. The other thing is if you're not a side sleeper, guys, and you really feel like just everything's out of alignment, you can go to a chiropractor to get an adjustment. Now, this is the only thing I'm going to tell you, or a massage, but you must see somebody who's certified in giving massages or chiropractic care to somebody who is pregnant. This would actually go for acupuncture too. These are all safe homeopathic things you can experience during pregnancy, but if the practitioner does not know what they're doing and they hit the wrong spots, they can actually trigger labor. So you want to make sure that you're only seeing a practitioner who regularly sees and knows how to treat a pregnant woman. So that was a good question. All right, so we had a question. We had a couple questions on yeast infections. Both were related to medication. So let me answer these. Is fluconazole tablet 150 once per day safe while breastfeeding a 4-month-old? Could it affect my breastfeeding baby? So fluconazole is commonly used when women are pregnant or breastfeeding for yeast infections. And yes, it is safe for breastfeeding and you can go ahead and use it. It's actually really safe. And one of the things we'll also do is we'll actually give you fluconazole if you get a yeast infection of the breast. So if we're treating baby for thrush and you for yeast, we'll oftentimes use that as well. Another question we got was, I'm having a yellow to greenish discharge and I'm diagnosed with vulvovaginal candidiasis, which is basically a yeast infection. My doctor advised me to use Canesten 500 milligrams for 7 days. Will it be safe for my baby? So the Canesten is safe for use while you are pregnant. And it's a very good treatment for yeast. However, greenish, yellowish discharge is usually not yeast. So I want to make sure you guys know if you are having any kind of discharge, you need to make sure you actually go into your doctor and that they swab you. So what does it mean to swab you? It means that they're going to take a sterile Q-tip and they're going to gather some of that discharge and they send it to a lab to test it. So we can test that discharge to see exactly what's going on. Greenish, yellowish discharge is especially associated with smell or itching, is usually bacterial vaginosis. Bacterial vaginosis is a bacterial infection, and that needs to be treated with antibiotics. If you give that Canesten for bacterial vaginosis, you're not going to treat or cure the bacterial vaginosis. You're just going to cover up the problem. So you guys want to make sure if you are calling your provider to describe something, you need to make sure they ask you to come in and swab you so that they can treat you for the right issue. Now, for those of you who are joining us, My name is Dr. Samantha. I'm the maternity mentor. We're here for another one of our live Q&A sessions. Please feel free to put your questions into the chat. And for those of you who wait until the end, I'll give you a sneak peek at tomorrow's video. Let's go on to the next question. So I had this question, and since Gabriella's online, I'm going to do that one next. It came from her as well. So I have a question about the fetal ejection reflex. Can you explain a little more on this? Can this even happen if you have an epidural? And does this reflex happen to all women during the delivery process? It sounds kind of unbelievable if you're not trying to push and your body just does it for you. So the fetal ejection reflex is kind of exactly what is said in the question. It's this reflex that your body has that when you get to a certain point in the labor, your body will actually just push the baby out for you. Basically, your uterine contractions, they spend their time. You have this cervix, right? So a cervix should be long, thick, closed, okay? Now what happens is uterine contractions, they pull this cervix and it thins and it thins and then it opens and it goes to 10 centimeters and then your baby comes down, right? Well, if you go ahead and your body gets that 10 centimeters and it's left to its own devices, the uterus eventually starts basically like contracting almost from the upper end, pushing baby down the vaginal canal, and baby will eventually go down. So, and come out, right? So the thing is that this is a very normal, natural thing. So can it happen during a vaginal delivery with an epidural? The answer is depends. Okay, this is very, very, very important. So what's actually one of the most important things for this to happen has little to do with anesthesia. What it actually has to do with is how safe you feel. So for those of you who follow me a lot, for those of you who know me, I'm very big believer in that we're all cavemen. I think a lot of our body's processes, a lot of how we parent, a lot of our instincts, both as human beings and as pregnant people and as families, comes from us being in caves. And the fetal ejection reflex actually also has the same idea. We're mammals. As mammals, we need to feel safe and secure in order to have a very calm and controlled delivery. When our bodies are under threat, we release catecholamines, which are stress hormones. And those stress hormones will actually shut down labor. Now, for those of you guys who kind of hear all the warnings about different types of things like epidurals shutting down like contractions, right? How many times do we hear that? An epidural can cause you to stop contracting. Well, if you think about it, during the epidural process, you're having somebody come to your back, cleaning it off, sticking in a needle, using lidocaine, injecting a medication. It's scary to go through. You have to be put into a very weird position to do it. And then it kind of hurts a little bit when you get the numbing medication. And then they're giving you more medication that your body's not used to. This is a stressful situation, okay? If it's your first baby, you're also still freaking out from like anxiety. Like we're all anxious during our first baby's delivery, right? So all of these things send all these stress hormones to your body because in the end, we're still in caves. And it says, hey, stop, I'm not safe. So then the fetal ejection reflex won't happen because your labor's basically shut down. And now we're trying to force it through with other medications. Now, don't get me wrong. Just so you guys know, I'm totally pro epidural if you want an epidural. I'm just saying this is how that works. So it's very important for your birth to be extremely peaceful and calm and for you to feel safe and secure for that reflex to happen. Now, while most of the literature will say if you have an epidural, it cannot happen, it absolutely can with an epidural. It absolutely can, especially with these lighter epidurals, which we're now using. Most of the epidurals now, you're still going to feel a lot, especially at the end, because we need you to feel in order for you to push adequately, which means your body, you are connected to your body and your body is still doing everything it's supposed to do. So under the right circumstances, your body can actually allow itself to just deliver the baby on its own. Okay. And that, just so you guys know, if you ever watch those water birth videos, that's oftentimes what you're seeing in a water birth is the fetal ejection reflex. Because those moms are usually just kind of going with it. And then all of a sudden the baby's there because that's what happened. So I hope that answered your question. And it was a great question. It was an awesome question. Okay, so I got a couple questions on depression and pregnancy. I always love getting these. For those of you guys who don't know, I now practice as a psychiatric nurse practitioner because I went into this to help women who are pregnant and breastfeeding with depression and make sure they could get medication if they needed it. So I have a question from India. It says, hello, ma'am. I'm from India, and your video was very helpful to me. I have anxiety and panic attacks after the COVID-19 pandemic. I'm now 4 months pregnant and taking some medications. People scared me, telling me that I should not take any medication during pregnancy. I'm helpless. Please reply. Okay. So I think that this is an extremely important question. The other one came from another one who said, I have medication for depression and anxiety. I'm scared because I'm 3 months pregnant and I don't know what to do. Okay. So a lot of people will tell you don't take any medication because of birth defects. This is why moms don't want to take antibiotics. They don't want to take anything, right? Okay. Every single mom walking down the street has a 2% chance, 2 to 3% chance of developing a birth defect spontaneously, even if you have no risk factors whatsoever, nothing, right? So it can happen on its own. Most antidepressants have less than a 2% chance of having you develop a birth defect from the medication, 2% or less risk. So basically, it's about the same. Untreated depression and anxiety can lead to greater than a 3% chance of birth defects. Untreated anxiety and depression bombard your body with stress hormones like those catecholamines. Your baby gets put under epinephrine and cortisol and all these other hormones that are really not good for you or the baby. As a result of this, it attacks the placenta. The placental blood flow can decrease. You're at risk for miscarriage. You're at risk for stillbirth. You're at risk for preterm birth. You're at risk for a baby that's small for gestational age. These babies are also at higher risk for learning disabilities, ADHD, and mood disorders as they get older as a result of you having untreated anxiety and depression during pregnancy. We now know it is essential to treat these things. Additionally, there's tons of medications that are really safe, even in the first trimester, to treat these disorders. Okay, they're disease processes, and it's very important that you feel good. If you don't feel good, having panic attacks every day is not good for you, and it's not good for the baby. It raises your blood pressure, your pulse, everything. So for those of you who are taking medications during pregnancy for your depression or anxiety, yes, go to your healthcare provider. Make sure they're safe. There are a few that you would want to switch over into something else, but just confirm with your local healthcare provider and please keep taking them if that's what's best for you. And so, yes, don't let anybody tell you otherwise. It's important for your mood to be good. Okay. Hey, Jasmine. I'm 37 weeks with my second baby. Congratulations. I had an episiotomy with my first baby because my doctor said that I was already starting to tear and I had her within 3 pushes. How can I avoid another episiotomy and what can I do? My doctor suggested against raspberry leaf tea, primrose oil, or anything herbal. Okay. So first, beg, plead, tell everybody you don't want an episiotomy unless your baby's life is in danger, and keep saying that over and over. It's actually been proven that if you tear and then receive an episiotomy, you can actually tear more after the episiotomy. So it's better to naturally tear instead of getting a episiotomy. That's actually reverse, and most women won't tear as bad as the episiotomy is. So you just need to tell them, and unless it's saving my baby's life, tell them no. So perineal massage. We have a video on perineal massage. That is what I would recommend. So perineal massage Basically, the perineum is the skin that goes between the vagina and the anus, right? And if you stick your fingers inside the vagina, you can kind of stretch that skin and massage it like this. So I would get some coconut oil or some lubrication. You can use primrose oil usually. I guess I have to say don't use primrose oil because your doctor's saying no, but usually we use primrose oil. Mineral oil is another good one. And you can kind of stretch that area, and you just kind of run your fingers back and forth to kind of stretch the tissue. You can also do it on the front end. Normally, Jasmine, I would tell my couples, tell them to go together to the healthcare provider at around 37, 38 weeks and ask the healthcare provider to teach your partner how to do the perineal massage for you. It's very hard with that big belly at 37 weeks to really get down there and be able to stretch. I mean, most women can do some, but it's actually easier for somebody else. And partners really want to be involved. This is not a sexual thing, and they're not going to view it as such, but a lot of partners really, really want to help in any way they can. And a perineal massage, it actually might help because they can see everything and they can kind of let you tell them, do you feel the stretching or whatever. You can also in labor ask them to use mineral oil when you're pushing and do the massage as you're pushing. If it's the same healthcare provider, though, unfortunately, you're just going to have to keep telling them, please don't do an episiotomy unless it's to save my baby's life, or unless they see something that you don't and they're going to tell you about it. In my career, I've actually only seen a handful of episiotomies because we basically don't use them anymore. They're very, very, very rare where I'm at. They've really reduced the amount. So that's what I would suggest is perineal massage. Primrose oils, raspberry leaf tea, and that stuff, that's really more for like ripening the cervix and stuff like that. That's really not going to help avoid necessarily tearing as much. So I hope that helped, Jasmine. So I had a question this was a very interesting question on twins. I have twins with 2 different EDD. Can they be given birth on the same day naturally? EDD is, you're welcome, Jasmine. EDD is estimated date of delivery. So this mom, for everybody who doesn't know, is saying she's pregnant with twins who are due on 2 different days. So this is like saying twin A is due on January 1st and twin B is due on February 1st. Believe it or not, this can happen. Okay? So how does this happen? One of 2 ways, usually. 1, she has a bicornate uterus. So that means she has a heart-shaped uterus. She basically has 2 uteruses, 1 and 2. And each uterus has a fallopian tube, and each uterus gets pregnant. So usually what will happen is this fallopian tube releases an egg, it fertilizes, baby attaches. The next month, this one releases an egg, and she gets pregnant that way. So that's how you end up with 2, okay? With a bicornate uterus, you're delivering via C-section, and they are most likely going to plan your C-section and deliver the babies on the same day. One will hopefully be close to term, and one will probably be a little bit preterm. The second way is, believe it or not, you have a mom who releases one uterus, your regular standard uterus. She releases 2 eggs at 2 different times. They get fertilized and they implant at 2 different times. For that mom, you will have the same idea. Once you're pregnant with twins and you go into labor, both babies are usually coming out. It is extremely rare that the second baby won't be delivered within 24 hours. So once you're going into labor, we really can't stop the other one from coming. So you will probably deliver both on the same day. Now, whether it's natural or not is left to be determined. We have a twin video that we can link into the description. Most twins are delivered in an operating room, even if you have a vaginal delivery, because we never know what's going to happen for sure with the second baby. So we want to be ready to do an emergency C-section if we need to. Now, if you are like in imminent delivery, we know you're like 8 centimeters, we're not stopping it. And let's say one baby's like 36 weeks and one baby's like 32 weeks. Depending on their positioning, they may tell you it's better to have a C-section. But that's like a very complicated thing. So the best thing I can tell you is, yes, most likely they're going to be given birth on the same day. Yes, it is possible to give birth to them vaginally. However, it just kind of depends on what's going on. Okay. We had a question on urinary tract infections. I'm 16 weeks pregnant and I have a positive urinary tract infection. My gynecologist suggests I take citralca syrup for 7 days. Is resistant bacteria curable? Please tell me. Okay. This is a fantastic question and it has a lot of different pieces to it. So for starters, citralca is not used where I'm at in the US. So I cannot tell you if it's safe. So what do? You're asking me because you're not sure. One of the things you can do if you're ever not sure about a medication or an over-the-counter supplement that you've been recommended to use is go to your local pharmacist. In addition to your healthcare provider, who should have training to tell you whether something is safe to use during your pregnancy, your local pharmacists have specialized training in medication. They know whether things are safe to use during pregnancy. They also know if this medication interacts with other things you might be taking. So if you're not sure, please call your local pharmacist and ask them, right? Okay, that's number one. Number two, she mentions treatment-resistant bacteria. So I love this because it gets into stuff about antibiotics. So like I told you guys, most people don't want to take pills while they're pregnant because they're scared about the effects that it could have on the baby. It's very important for you guys to understand that antibiotics are used to treat a bacterial infection, and bacterial infections, if left untreated, can lead to miscarriage, stillbirth, and preterm birth. Okay. It's extremely important that we treat that. I can't tell you how many times I've seen women go into preterm labor and give birth prematurely due to urinary tract infections, very specifically urinary tract infections. So what do you guys need to do? So this is how antibiotics work. You find out you have a bacterial infection, they give you the antibiotic. Consider it like an army, okay? And the antibiotic comes along and it's trying to defeat the army. So it starts taking out some of the guys. But these guys in the back, they're like, wait, I see what they're doing. I got it. And so they start to build a defense. Now, if you keep taking the antibiotic, they're never going to get to make their defense. It's just going to be done. You're going to get rid of all the bacteria. But if you stop taking it when you start to feel better, which can be in as little as 24 hours, well, these guys back here then have plenty of time to build up a defense, right? They saw how this works. They're going to build up a wall. And then they're going to start building a bigger army behind the wall. Now, a couple days later, you start feeling bad again because now you got this big army of bacteria. And guess what? You start to take that same antibiotic again because you didn't finish it. You're like, oh, I should have taken it. And you know what happens? You can't break down the wall. And now you have a treatment-resistant bacteria. And so then what does your doc have to do? Your doc has to give you something stronger and something that may not be as safe for your baby. So this is why it's so important that if you are prescribed an antibiotic, you take all of it as prescribed. Okay? So that's extremely important. For those of you who are joining us, please remember to put any of your questions into the chat. And I will try to answer those live for you. And at the end of this video, I'm going to give you a sneak peek at next week's video, okay? Or sorry, next week, tomorrow's video. Okay, so my wife's placenta had a blood spot in it. And when we were looking at it, we found out she has thyroid problems, T3 and T4. Can you explain the pros and cons? So there's a lot kind of missing from this question. So I'm going to just do what I can. So thyroid. The thyroid gland, it's here, okay? This little gland right here is one of the most important glands in your entire body. The thyroid hormone regulates part of your heart, part of your stomach, part of your respiratory system. It can cause you to have trouble sleeping. It can cause you to have anxiety. It can cause you to have depression. It can cause you to lose weight. It can cause you to gain weight, et cetera, et cetera, et cetera. Okay. It is literally one of the most important pieces of your entire body. If it gets out of whack, you can have serious consequences. For example, if your thyroid is too high, your thyroid hormone is too high, you can have hypertension, which can lead to seizures, right? High blood pressure, which can lead to seizures. High heart rate. You can start losing weight like crazy, and the baby may not be getting enough of the nutrients it needs. So that would need to be treated. Okay. Just like low thyroid needs to be treated. It's extremely important. Okay. So when you have thyroid issues, it's important that you go to your healthcare provider and you let them do blood tests and start prescribing medication as needed. Now, the thing that stinks about thyroid is, let's say you're low thyroid, so they're supplementing you with thyroid hormone. You may need to get your blood drawn every single week, and they may be changing your medication every single week. It's very important you stay on top of this. If your thyroid is not treated properly when your baby comes out, your baby may be born with thyroid issues that may require the baby to stay in the hospital in the intensive care unit for treatment. So make sure you're taking the thyroid seriously. Postpartum, let's say your pregnancy was fine, and postpartum, you start to feel bad. Some women will develop a thyroid condition postpartum, post-delivery. So if you're not feeling well, you need to go to your healthcare provider and ask them to check your thyroid levels. A bad thyroid can cause anxiety and depression. So when somebody comes to me with those two symptoms, I make sure I test their thyroid to make sure it's not been an issue. All right. So we had a great question/comment on the acid reflux video, and I thought it was fantastic. So I think I'm going to go ahead and I'm going to close here. For any of you who are still on, if you have a question, feel free to put it into the chat. Okay. All right. So my acid reflux is so bad, I throw up everything. I am in my third trimester and literally only weigh about 5 to 7 pounds more than my pre-pregnancy weight. I'm at my wit's end. I cry because I'm so hungry and so scared to eat. Everything hurts. Even eating feels like pressure in the chest and lava going down. I just don't know what to do anymore. I've had a routine with Pepsid in the morning and then my Lanta at night. I eat close to nothing, and what I do eat is bland, but it still finds its way back. I have my hours cut back at work because they think I need rest. I'm sure it's because I spend all my time in the bathroom. At this point, it's affecting every part of my life negatively, and I don't know what to do. Putting a comment on it, which I also thought was extremely helpful. I thought it was really good insight. And what she said was, have you brought up hyperemesis to your doctor? I'm currently dealing with my third, and that may explain why you're feeling so bad. Okay. So I thought that this was a great comment, and I thought it was a great reason that it might happen, which is that you might actually have hyperemesis gravidarum, which is why you're not getting relief from your current treatment. So I have an acid reflux video, and it's linked into the description. And this was on that video. So I am assuming she watched it. But there's a couple of things you guys should know. The biggest thing is you need to ask them to test you for H. pylori, especially when you are in your third trimester. You know, they do have you drink this little tiny drink, which is safe for pregnancy, but by third trimester, it's really seriously safe. So what happens with an H. pylori test, there's two ways they can do it. One, they can do an endoscopy where they scope you while you're under anesthesia and they take a biopsy of your stomach. They're not going to do that while you're pregnant. But the other one is super simple. You go to a lab, and what they do is they have you blow into this little bag. It's like kind of like a balloon. You just go, and it puffs up. Then they have you drink a little drink. It's like about this much. And you go, goop. And then 10 minutes later, they give you a new bag and you blow in that bag. That's it. Takes like 15 minutes total. That test can test you for H. pylori. H. pylori is a bacteria that sometimes occurs in the stomach and can cause serious, horrific acid reflux. Okay? H. pylori if you're diagnosed with it, can actually be treated really easy with omeprazole and an antibiotic. And that's it. Okay? As simple as that. It's so easy. But you need to be diagnosed before you can get that treatment. So what I would be telling you is ask your doctor to test you for H. pylori using that. The next thing is I want you to think back and think, she mentions bland, okay? And bland is good, brat diet, absolutely. But sometimes we're actually getting like a really strong acid reflux type of effect because we are actually eating something that is sensitive to us in our diet. So a lot of people tend to go bland, but one of the things we end up eating a lot of is gluten, right? So gluten is breads, okay, crackers, stuff like that. If you are gluten sensitive, that could actually make it worse. Now, you may have never known that you were gluten sensitive. This may have been something that you didn't even realize. The way to try to test this out to see if it's possibly like a gluten intolerance, or if you're eating a lot of dairy, could also be a dairy intolerance that's adding to it, is to try to eliminate a majority of that for a day or two to see if the acid reflux gets better. So what you would do is if you're eating a lot of crackers and breads and stuff like that, switch for a day maybe to like stuff like, bananas and maybe oh my gosh, I'm sorry, rice, maybe some yogurt, stuff like that, okay? And same thing for dairy. Maybe for a day or two you try that. Dairy products are bases. That means they counteract acid, so you can use that to try to calm down some of the acid that you're experiencing. And then you want to ask your doctor if you can use something actually stronger. So they try to avoid some of the stronger stuff when you're pregnant, but you're in your third trimester. Even a couple weeks, like 2 weeks of omeprazole might do you a lot of good. So ask your healthcare provider if you are allowed to use something like that. And now for the person who commented saying, well, maybe this isn't even acid reflux. Maybe this is hyperemesis. They're right. This could be hyperemesis. They're 100% right. So even though it seems like it's acid reflux, you might actually have some sickness going on. So maybe ask your healthcare provider if you can take some B6 and some Unisom, like we mentioned earlier, or maybe even some ginger. Okay. So I think that's a really good question. And then finally, what you got to understand is you're almost there. It's horrible. It's not comfortable. It's very painful. Magic mouthwash. If your mouth is a little bit upset, you can actually ask if you can get some magic mouthwash, which is like lidocaine and some Pepto-Bismol and some other things that you can like swish and spit. Some healthcare providers will actually let you kind of get a little bit that you can swallow. It just depends on the healthcare provider and your health profile. Okay. So I want to thank you guys so much for joining us. My name is Dr. Samantha. I'm the maternity mentor. We're here every Monday at 9 p.m. Eastern Standard Time for another one of our live Q&A sessions. For those of you, please share this channel with your friends and family. Follow us on Facebook, Instagram, and Twitter. We really appreciate all of your support. Please subscribe to the channel. It really, really helps us out. And then remember, you can come back every Monday at 9 p.m. Eastern Standard Time and ask your questions live. I love interacting with you guys. I have no problem doing it this way. I also answer questions that you guys have on the videos. So for some people, they put questions on the video. If they can't get back to us, we post these videos afterwards. We post the lives so you can go back and look for your answers. And we take it very seriously. I really, really appreciate it. And I'm usually the one who's looking at them and interacting with you guys, and I really love it. We also take your video suggestions. So tomorrow's video is actually a video suggestion that's come out of our live sessions. So tomorrow's video is on the RSV vaccine. The new RSV vaccine that came out that's recommended for women who are in their third trimester. Jasmine, you are probably on the edge of being eligible for it. Gabriella, you're there. So check it out. It gives you some information about that vaccine and whether you want to take it to help protect your baby. That'll be coming out tomorrow. And for those of you who didn't hear, I have a 2-part series on different beauty procedures like Botox or other things like that, and find out whether they are safe while you are pregnant or breastfeeding. So that will be coming up in the next couple weeks. So stay tuned for that. My name is Dr. Samantha. I am the maternity mentor. I appreciate all of you guys so much. Thank you for joining me. I look forward to talking to you guys next week. Bye for now.